Hello, everyone. Welcome to Leadership Advancement Mentorship Podcast, where we have the privilege of learning the journeys of leaders and also how mentorship has impacted their life. But today we're having a special edition where I will be featuring and highlighting women in leadership. In the Lamb Global community, one of our aims of operation is the Women in Leadership League. So we want to dedicate today's podcast to women in leadership. And specifically today, we have an author and that's going to share with us a new project she's working on. And also, we'll be encouraging women in leadership with a bias today for medicine, the medical field. Welcome with me today, Dr. Shimoyan. How are you, man? Good to see
I,
you.
I'm fine, thank you. Thank you
Did
for
I say your
having
name
me.
right?
The Nigerian way.
Okay, okay. Tell us in the American way.
No, no, no.
Shimoyan. Okay, okay, okay. Let's meet you, please. And so, tell us who you are and what you do, so that we can launch from that part. Thank you.
All right, thank you so much. Thank you for having me. So I am a physician. I'm here in Pennsylvania. Right now, I live in the Reading, Pennsylvania area, and I'm a physician, but I'm not just a physician. I'm also an author. I'm into writing. I've published several books, and we'll be talking about the one that's just coming out, and just about to come out. Yeah, and I'm also into music and photography, and so really am an advocate for bridging the gap between the arts and the sciences, and finding those connections, and also just bringing our full selves to whatever we do professionally.
Mm. Wow.
So
I mean,
yeah,
you actually do, in a sense that I thought I'm the only one because you look like an odd one out in your field when, let's say, whatever you're doing, and there are so many aspects to you. And I always appreciate creativity, innovation, because I believe very well that every one of us has something unique that we can offer to our world. And we don't have to
exactly.
apologize for it. It is who you are, what is in your DNA that you manifest in. So let's talk
Exactly.
about we highlighting women in leadership. First of all, tell us about your leadership journey. What does it look like? Where at what point in your life did you become aware of your leadership potential?
That is a good question. It's funny because, when I was applying for my MPH program, the Master of Public Health program at Johns Hopkins,
Mm,
I don't remember much of what I wrote in that essay, but I remember that I included a statement about always seeing myself as how I will always see myself as a leader. I don't even know where that came from because it's not like I grew up
mm,
seeing myself as a leader. If you know what I mean. But I remember that one statement. And to be honest, I'm not sure where it came from. I don't, I can't really look back and see any one point in time where, oh, I suddenly realized that I'm a leader or whatever, but looking back, I've had various leadership roles, even, in my younger life, in school, um, even as far back as secondary school. I remember it seemed random at the time. They chose me to be the house secretary, which meant that I would take minutes of,
mm.
of the meetings and stuff like that. How that happened, whatever, So you know at some point, so you just look back and yeah, I've had leadership roles all along the way, even if I didn't necessarily see myself as a leader.
Mm.
But in terms of my professional development, I can think about, well, maybe I
Mm.
should back up a little bit.
No,
So
no, 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 no. You can continue on that thread of thought.
okay,
At when did you become aware of that leader? When did you start seeing yourself as a leader? When?
so I again, I can't point to anyone any specific time, so I'm trying to think about, leadership roles that I've had professionally now. Yeah,
Mm. Okay,
so
okay.
as a
Okay, okay. Now, the point I want to make is I
mm,
want the audience to get
mhm.
something straight. It's leadership is not about roles that you play.
Okay.
It's all about that because all the things I've had some pre-talk with you, and I see all those things you talk, they are leadership, and
Mm-hmm.
it's not about a position, it's not about a
Mm-hmm.
title, it's
Mm-hmm.
all about the awareness that you realize that wow, I just have this potential to
Mm-hmm.
because in my new book I wrote called Lead Yourself is
Mm-hmm.
the foundation of all leadership is personal leadership.
Mm-hmm.
Because you are such a dynamic leader, and I want you to know that because it takes a leader to be in science and you still doing hard stuff. You want to go like this, and you want to go. You just a leader always find a way, or or they make a way. That's something about leadership. So I just wanted to be aware of that, potential because it's going to come out in this conversation that we'll be talking about. Yeah. So what do you think about that?
Yeah, well, I think you're absolutely right. So, and thank you for bringing up the whole connection between art and science and,
Yeah.
connecting those.
It takes a leader to do that.
And
A follower will
at,
just stay with science. A leader, we have to co- go into this. It takes leadership for you to be moving that. You just felt that wow, I can do this. I can do this. That's leadership. It's leadership that take you through all those parts, and it's so unique. And I want you to have that. I'm giving you to that as a complimentary and to have
Thank you.
all the part that all the stuff you've done, those are leadership. Because
Thank you.
it is not like following, it's not like a pattern. This is not a pattern to it because and I wanted to share this because I know someone is listening to us right now that maybe that the person has been going through something like something wrong with me, the way I'm thinking about,
Mhm.
so that they realize that no, you're not weird, you're not crazy, you just you.
Exactly,
Help us to help
exactly.
somebody, please.
I,
Yeah.
I think what you're saying is so important because I used to feel as if there was something wrong with me, and that why
Hmm.
do I keep wanting to do all these other things? After training as a dentist, getting an MPH from Johns Hopkins, and then going to medical school, I still kept wanting to, play my piano. I still kept wanting to sing. I still kept wanting to write. I still kept wanting to do all these other things. And looking back, these interests were there all along. But my parents told me that writing was something you do in your spare time. I was told that music is a hobby. You have to think about a real job, a real career. And even after getting the quote unquote real career,
Hmm. Hmm.
I still kept wanting to do all these other things. And I had to like really get creative and find
Hmm.
ways of bringing my interests together, whether it was helping medical students to start a literary journal where people could express themselves in terms of artwork, poetry, narrative writing, and getting that
Hmm.
started when I was at what was then a new medical school. It's now Geisinger Commonwealth School of Medicine, even participating in their talent shows and different events where
Hmm.
students and sometimes staff members would
Hmm.
get together and sing, perform, and that sort of thing, And so there was all that going on. But I really had a hard time, like really incorporating it into my regular work. And at some point, when I was working at an inpatient addiction facility, and I would do these group sessions with teenagers and young adults, and talk to them about the developing brain and how their brain was still developing, and that's why um, you know, their prefrontal cortex is still developing. That's why we can't always count on them to make the best decisions. And sometimes I would talk about the research we were doing there at that facility. And at some point, I thought, maybe I could incorporate music into what I'm doing. So I started taking my ukulele to the sessions, and I would sing and play. And sometimes maybe one of the patients might be musical, might have a song that they want to sing and play. There was this one teenager who was there once who had a ukulele that she brought, and she had composed a song while she was in treatment, and she ended up sharing the song with us, and it was just so
Hmm.
moving. So those are just a few examples. I also got involved with the music and medicine committee of the American Medical Women's Association,
Hmm.
and we've done a number of initiatives. Last September, a number of us went to Germany, to Berlin in Germany, for a conference on that was organized by the International Association of Music and medicine, and we talked about our
Mm,
work. I talked about my women in medicine exhibits. My colleagues talked about how they incorporate music into their work. Um, I can give a few examples. Dr. Mary Roro, who's our she's the chair of the committee. As a young child, she would go with her mom to nursing homes, and there's a time when she played. There was a patient who was very depressed and hadn't spoken, and then when she played her violin, the patient came alive and started singing, and that
mm,
just changed everything, and the patient who hadn't spoken, it's like she just, turned things around, and the patient just came out of
mm,
that came out of that depression and just
mm,
started. There's I can't remember if she started singing or speaking, but whatever it was, the music had really
mm.
had an impact on that patient. And there's so many stories like that. Another of my
Wow.
call. Yeah,
Okay. Wow.
yeah,
We can actually go to so many places today,
yeah,
but I
yeah.
want us to camp with your book. So let's talk about the
Okay.
book. And let's talk about this book. Why this book? Why this title? And why now? Can you show us the book, please? Yeah.
So it's called Girls Become Doctors and Much More, Inspiring Stories of Women in Medicine.
Mm,
And it didn't start out being a memoir. It wasn't meant to be a memoir. I'll tell you how it started, but it ended up being something of an academic memoir and a series of profiles about uh, women in medicine, many of whom I've met and interacted with myself.
mm,
So I, about 10 years, exactly 10 years ago, 2015, I participated in a medical humanities fellowship at Georgetown. It was on a part-time basis. I didn't move to Georgetown, but yeah, but I worked with Dr. Carolyn Wellberry, and I had to do a project. I needed to do a project for the fellowship, and I wasn't sure of what to do. So one of the few times when I physically went to Georgetown, I was walking one of their hallways, and I saw these pictures on the wall, on one of the walls, of people in white coats holding books and saying, read. So it was like a part of a reading campaign, encouraging people to read. And then I got the idea of, yeah, wouldn't it be nice to have pictures of women, maybe women physicians, and inspiring people and that sort of thing. So I came up with the idea of curating a small exhibit of women in medicine, and I ended up doing that. And that was my project
mm,
for the humanities fellowship. So I had these women in medicine that and I took the pictures myself. I mean, some of them were historical figures, so I just got pictures from the maybe the historical society or wherever.
yeah.
But otherwise, they were pictures that I took, and then I had some inspirational quotes from them, from some of them. And then afterwards, I kind of thought, well, it'd be nice to have this as a traveling exhibit and all that. But then that kind of just, you know, ended up on the back burner, and life got busy. Life got
Wow.
busy, and then I moved, and then there was COVID, and then, and then sometime after I moved here, I, started thinking about the idea of uh, putting the contents of the exhibit into a book. And it was just going to be, a small, maybe like a pamphlet almost, a small booklet,
Mm,
just a few
mm,
short profiles about these
mm,
different women in medicine so people could read and be inspired. I really wasn't thinking about writing about myself, but at some point it seemed like, well, what's the point of writing about other women
mm,
if I don't write about myself? So I
mm,
started thinking about how I could include some of my own story. And it just grew and grew. I started adding more women to the story, to the book, to the manuscript. Getting profiles of more and more people that I had met and interacted with, including a whole group of people that I met on social media. Um, yes, and it just grew and grew. And
mm,
then I decided to include some of my professional development experiences, like my Fulbright experience, and then
mm,
my experience with the Europub Health Program, which was funded by a program that's similar to the U.S. Fulbright, but it's a European program. And I had gone to
mm,
France as a scholar in that program, and also spent
mm,
time in the UK as well in that program. But I had
wow.
all these reflections that I had written about these
Mm,
experiences,
that's
and it was
awesome.
like, why am I just keeping these
Mm,
to my keeping them to myself? Why not include them in the book?
mm.
So anyway, and then
Can you just
so
permit me to just interrupt you? I want us to
sure,
get into the book properly. Why
sure.
this title? why girls become doctors. Why do you decide to I'm a strong advocate for women, but also I want to be an advocate for men too. Why did you decide to
Yes.
leave men out and
No.
just what about the boys?
So
Do you
so
think
so
it's
that's
wrong
the
for the
thing.
boys to become doctors?
Of course not. Of course not. But
Why did you
nobody
why
questions.
did you decide to focus on
uh,
girls become doctors?
so I can get into that. I can get into that, but it's a long story. Actually, even when I was younger, when I was before I made the decision to do dentistry, you know, part of what my struggle was back then was the idea that, I mean, in all fairness, nobody told me that I couldn't be a doctor because I was a girl. Nobody told me that. But I did get mixed messages about what my priorities were supposed to be as a girl. And to me, it was confusing. So I really
Mm,
ended up thinking that, if I became a physician, I wouldn't have time to do the things I was supposed to be prioritizing as a woman. That was part of it. I mean, there were other issues going on too. So that the messaging that we got as young girls really impacted me. It really impacted my decision making at that young age. So there's that. Now, when I went to medical school in Hershey, there were actually more girls in my class than guys. I mean,
mm,
I think it was close to 50, but it might have been like 49, 51%, but we were actually slightly more women in my class. Uh,
mm,
but despite all of that, women still face a lot of barriers. We still face a lot of barriers. We still face a lot of discrimination. We still, many of us still have experiences where you're assumed to be a nurse. There's nothing wrong with being a nurse, but you know what? You're assumed to be anything but a doctor, because you're a woman,
mm,
and I actually have talking about the title specifically. So there's a very short essay that I had published on this website called Pulse, Voices from the Heart of Medicine. I used to be one of their editors, and I had written like um, short essays for them for a while, a couple years
okay.
ago.
Yeah.
And one of my short essays was titled "Girls Become Doctors," and I gave specific examples of things that women sometimes experience or things that I had experienced in the workplace. But I also started with a story about how one of our faculty members when I was in medical school said, so she's a physician, she's married to a lawyer, and somebody had asked her young son, who was probably like 4, if he wanted to be a doctor. And he's like,
Mm,
no, only girls are doctors. And he said that because his mother was a doctor, right?
mm,
And I remember pointing that out, that he probably would have said boys become lawyers because his dad was a lawyer.
mm.
So but that's kind of where I got the title from. But in that
Okay.
short essay, I also shared some other experiences that I probably don't want to go into now. But I wasn't planning to, but I ended up including that essay in this book as well because it just seemed like it made sense, and
Mm,
that's sort of where I got the title from. And
okay.
then so become doctors, girls become doctors, and much more. The much more part is you know, it refers to how, we can be musicians, we can be photographers and all of that, and we can still be doctors.
Oh, wow. I got
And
that
so,
now. I got that now. So what you
yeah,
mean is girls can become doctor and much more beyond
exactly,
becoming a doctor.
exactly,
Oh, that
exactly,
makes so much sense. Wow, that's
exactly,
great. That's
exactly,
awesome.
exactly.
This
So,
is really, really important, for people to know. And that's why I just love this, because I love this. I can tell you this. I am a witness to this because when I was in medical school, I'm the kind of person that has passion for something else. And
mm,
people try to see you as not
exactly,
serious.
exactly,
They believe that, oh, the only thing you should focus on is just medicine. And
exactly.
I'm the kind of person that while we are waiting for a consultant, waiting for a senior person
Yeah.
to lead the world round, I'll be reading Zig Ziglar.
Yeah,
And people are looking like, are you really serious? So,
exactly.
and the thing is, and I believe that when and I've seen a lot of people, I've seen some of my colleagues that have distinguished themselves, and they
Hmm.
still finished, they still graduate.
Exactly.
One of our colleagues, for example, she while we were having some strike, because then in Nigeria there's so many strikes,
Mm.
she pursued accounting and she became a
Wow.
chartered accountant.
Wow.
But she didn't
Wow.
let nobody knows it. She kept it close
Wow.
because it's like they don't really encourage anything else. When they
Hmm.
see anything else, in fact, the day I got to know about it, and she's a lady, and I told her the way she jumped at me that who told you? Who told you? And I said, calm down, calm down. I know it's true. Why are you scared? She said, you know how this medical community is. She didn't want anybody to know that they're gonna focus so much on her,
Yeah.
and these
Hmm.
people they might prevent you from passing. They will say that you're not serious. How can you go and pursue accountancy? So
Yeah.
this is really a good uh project, and I really applaud it because
Hmm.
this was gonna free and I realized a lot of and okay, let's just focus on women. When we talk
Hmm.
about women in leadership, a lot of
Hmm.
young, female students will really be liberated because they have other passion and
Exactly.
they've been looked at. You're not serious. You're supposed to be studying only this thing.
Exactly.
So how do you, I know, how did you address that part? To a young girl being brought up. I know some parents are listening to us right now. That how do you want parents to really navigate that, situation
So
when they notice other passion from their
yeah.
young
Yeah.
ones?
Yeah, I think it's important for parents to realize that your child can be more than one thing. And being a doctor doesn't mean that you can't do other things as well. So
Mm,
there's so many physicians who are also musicians or scientists who are also musicians. And sometimes they'll talk about how they had to make a decision at one point. Do I study music or do I study medicine or science or whatever it is? And one thing is that, you know what, you can be a doctor and be a musician. But if you
mm,
decide to be a musician, that's all well and good. You can't be a doctor at the same time, right? So
mm,
I think everybody has to, and you can't be a doctor without going to medical school. That's my point. But you can be a
mm.
doctor and still play music. And, whether or not you incorporate it into your medical work is a separate discussion,
Yeah.
but you really can do both. And and many of us find that we're better clinicians, we're better doctors, we're better at whatever we do when we bring our whole selves to our work. um,
Mm,
and if you even think about it, for people who have, I mean, I didn't have formal musical training growing up, but for people who have formal musical training, think about all the things that musical training does for you. You're training, you're reading music. Let's say you're playing the piano, using your fingers, maybe using your feet for the pedals. Think about all the hand-eye coordination,
mm.
hand-foot coordinate, all the coordination and all the things that are going on at the same time. Learning rhythm, rhythm is very mathematical. It's very
Yeah.
mathematical. You could have a kid who struggles with fractions in math class, right?
Mm.
But maybe that kid is musical. So maybe you can use musical rhythm to explain the concepts of fractions, because it and,
Yeah.
and that kid will understand it because that's something that comes naturally to them.
Mm,
So those are
mm,
just some examples.
mm,
And then it's not just music, art in general.
mm,
There's some medical schools where they take students to museums now and have them observe art, and discuss it and
mm,
think about how they can translate those skills to the clinical
mm,
setting. So for example, learning to critique art and looking for the very, very, fine details and all of that, being able to appreciate subtle differences in color and texture, that could be
mm.
translated into reading x-rays in the clinical
Yeah.
setting.
Yeah.
You see, so there's so many ways in which, art
One
in
can
general and
relate,
music can
relate both
exactly
fields.
can really
Okay.
um, help us to be better scientists, help us to be better
Okay.
clinicians,
Okay,
co-
yeah. So let's talk about
communication
who
skills.
are the women that you look up to in medicine, the women in medicine, the women in leadership that have inspired you. Yeah.
There's so many people. If you want me to talk about people in this book, I can mention a
Yes,
few
I
of them.
mean
I can,
that's why I'm relating it to this book now. Who are the
yeah.
people that
So,
you highlighted, yeah, that have
so
inspired?
I so I talked about some historical figures who are long gone, who I obviously never met. So Elizabeth
Like,
Blackwell was the very first female physician in the U.S. And so people like that have really paved the they really paved the way for the rest of us. I want to read, let me see if I can find her quote. So she was the first female physician in the US. Her sister, Emily, was the third female physician in the US.
Really?
Yeah. And even though the older sister had paved the way, the younger sister still got rejected by 11 medical schools.
Hmm.
Yeah. So let me read, if I may, this Elizabeth Blackwell quote. It is not easy to be a pioneer, but oh, it is fascinating. I would not trade one moment, even the worst moment, for all the riches in the world.
Hmm.
So that's from Elizabeth Blackwell, and she and her sister really, they created opportunities for other women who couldn't train elsewhere. They created opportunities for them to train, and they, really, really made an impact. As a medical student, I also learned. I did a history of medicine project, and I learned about Ida Scudder, who was a medical missionary to India.
Hmm.
Now, if I can, her story is just so amazing. And if I can just briefly summarize it, she had been born in India to missionaries, and she didn't want to be a missionary, wasn't planning to be a doctor, didn't want to live in India. She had come back to the
Yep.
US for school. And then she was back in India visiting her parents. And um, her father was a doctor, right? In one night, three different men came to ask for help for their wives who were in labor. And because of the local customs at the time, they wouldn't allow a man, because her father was a doctor, they wouldn't allow a man to touch their wives.
Hmm.
And Ida had no medical training at the time, so she couldn't help them. And would you believe that in that one night, all three women died in labor,
Oh.
basically, essentially for lack of a female physician. So here
Hmm.
she was. She hadn't planned to be a doctor, hadn't planned to live in India or anything. But after that experience, she really took it as a call from God to do something about it. So,
Hmm.
after struggling and praying and all of that, she decided that, that she was going to come back to the States, go to medical school at a time when it
Hmm.
was hard for women to get into medical school, even here,
Wow.
and then go back to India and help the women. So that's exactly what she did. She became a doctor, went back to India, and basically lived there the rest of her life. She started roadside clinics, started a nursing school, and eventually a medical school, which is now known as the Christian Medical College of Vellore in India. And
Hmm.
I actually got to visit that school as a fourth year medical student from Hershey. I actually went to visit CMC Vellore, India. I did an international rotation there, and I write about my experience
All these
in the
journeys and
book.
experiences.
Yeah, in
Hmm.
the
So
book, yes.
what should people look for, and what should what thing of interest should people look for in this book?
So I didn't get to talk about my own my own first mentor in my academic job. So can I talk about her and then we talk about more about the book? You were asking
Yeah,
about the people
yeah,
that inspired me, or
yeah. I want to know what why do you think people should get this book? Yeah.
oh, because yeah, I think that it really showcases a a broad array of women physicians in different positions. There's
Yeah.
this historical section, right, talking about the people that I just mentioned, and then I talk about um, the people that I met at Geisinger Commonwealth School of Medicine when it was a brand new medical school, and some of the female leaders there, including my
Mm.
department chair, Dr. Janet Townsend, who was one of my early mentors. I talk about her and some of the other women leaders, and I also talk about their current dean, and then
Okay.
I talk about other. There's so many other people. Last year, I was invited back to Penn State to be the speaker for the white coat ceremony, and I met their current dean, who is the first. She's the first female dean of that medical school of Penn State College of Medicine, but she's also the first Korean American dean of a U.S. medical school. So yeah, so I have the book features several women like that who are the first
Okay.
one thing or the other. I have women I met, people I met during my Fulbright in Nigeria. The current um, Vice Chancellor of the University of Lagos, Professor Ogunshola. This is her, she's the first female to be in that position. I met her during one of my Fulbright trips to Lagos when she was the first female provost of the College of Medicine. I could go on and on and on. There's so many
Mm.
different leaders that are featured in the book. They're
Yeah.
people I've met, at different phases of my career.
Mm.
Um, I include some of the leaders of the American Medical Women's Association, the current leader of the Medical Women's International Association. So if you're looking for examples of leadership, if you're looking for
Mm.
examples of music and medicine, of arts and medicine, and how physicians have been active uh, in both worlds, both the world of
Yes.
arts and the world of medicine.
Mm.
Yeah, this is a book, this is a book that will showcase several
Mm.
examples of
Wow,
just that.
wow,
Yeah,
wow. We don't really have much time to get into this
sure,
book. We're still going to have a special magazine edition and that will
sure.
give people more info. But before we go today, when is this book coming out?
So September 8th is the launch date
The launch date?
for the
Okay.
print version, September
Okay.
8th, and it'll be available on Amazon and hopefully other places where books are sold, but definitely
Okay.
on Amazon.
Okay. Now, what is one thing that you want to close with about this book before we go today?
About the book, or can I just, I think the message of the book
Mm.
is the message that I end with, right? And I think that's what I want to focus on right now,
Yes.
is that I tell people, the readers, male, female, whoever, go be free. Do what you were born to do.
Mm. Mm. That's
Yeah.
good. That's good. And I like that, and I believe this message is so important because a lot of people they just kind of like they were really, I mean, they were just in between
Yeah.
being forced that you are brilliant, you know,
Exactly.
you
Exactly.
have to read medicine, this is what you should do. And I mean, and so many people are just like, and they really went, they finished it, but they were not really fulfilled because
Exactly.
they know that there's
Exactly.
something much more to them, that kind of stuff. And I mean, I'm an example of that,
hmm
and but what we really want to encourage in this podcast, we want to realize that you can be much more. You don't have to be
Exactly. Exactly.
ordinary, you can be
hmm
extraordinary.
hmm
And we want to say thank you, Dr. Simoyan. Thank you so much because I believe in this message and I want people to realize that you are not weird, you are not crazy. And
Exactly.
especially when you have when you have a nephew, when you have a niece that happen
hmm
to find herself in medical school, that they started having other expressions to their life,
hmm
and they need to read this book, and this book will show them how much more people can be. And because what difference will it make? And you're not just writing this book, you are
hmm
an expression of the book yourself.
hmm
And I didn't ask this question. Does this book highlight the journey you've been through as an author?
Yes, yeah.
Yeah.
I included some essays that I had written before, and they pretty much tell
No, I
my
mean your
story.
story, your story.
Yes, yeah, yeah.
Oh,
There were essays that I eventually decided to include when I decided to tell my story, and I had
that's
written these
good. That's
essays.
good.
One is about professional identity formation, and then
Mm.
there's another one that talks about incorporating music and art into healthcare.
That's awesome. Yeah.
Mhm.
Congratulations for the
Thank you
book
so
to come.
much,
And
Dr.
we're gonna
Koku.
put the link to get the book. We're
Mhm.
gonna put it in this on this YouTube podcast so
Thank
that people
you.
can get it. So
Thank you
thank you
so
so
much.
much for your time. And until
You're
I come
very
your way with another guest, the Leadership Advancement Mentorship Podcast is always the place to be. But we always say something. Don't just be informed. We want to encourage application so that you can experience transformation. Thank you and have a beautiful day. Bye bye.